We are hearing now from a special guest. She's a third-generation native Angelino, daughter of career public servants, the protege of community leaders. She's got a passion for service. She's a mom of a teenager. She has spent much of her career creating a California where all children thrive. And she was named the first African-American to chair the powerful Senate Budget and Fiscal Review Committee. I am talking about Senator Holly Mitchell. Good morning, Senator Mitchell.
Good morning. Thank you for having me on.
Oh, thank you so much for calling, checking in. You know, we are so much in need of hearing from our elected officials right now, the people representing us, because a lot of people are in crisis and there's a lot of misinformation being spread.
And I completely understand that, Dominique, and my colleagues and I here in the state legislature are really doing all that we can to try to dispel some of the misinformation that's out there and let people know we are working overtime to try to arrest this virus.
Now, I think this is where our civics lessons, you know, we maybe should review them, because people are looking for help. They're looking for information. And I think we're getting maybe one directive from our city, another directive from our state, you know, our county, and then the federal government. So what should people look to the state of California to do or receive information or help at this point?
I appreciate that. And I think people are seeing folks respond from every level of government, because we have that responsibility, and it's a good thing. It is a problem when it becomes confusing. And I think it's an issue of, you know, who responded first. I was listening to your previous segment, and I agree the federal government took too long. And I think as a result, you then saw municipalities. You saw, you know, the mayor come out with his directive for L.A. City in terms of, you know, quarantine in place, shutting down access to bars and restaurants. And then you saw the governor declare a public state of emergency. And so all these levels of government are kind of activating as they should, because we are experiencing a true state of emergency. And I think people should stay connected to every level of government. You know, as an LA County resident, like your listeners, you know, listening to our county public health officer, I think is who I listen to first and foremost to get information about the virus and what I should do to protect myself, my family, my friends and neighbors. And listening to every level of government to see what kind of relief we're all going to step up to provide to our residents.
Yeah, I think you probably know I'm always advocating recycling black dollars, as are you, and, you know, supporting our local businesses. How do we do, you know, if I'm a small business and I'm just in fear of losing my business because we are at this point pretty much mandated to shut down, what can I look to on the state level in terms of, you know, information and assistance?
And so at the state level, you know, as you said in my intro, I chair the budget committee. And last Monday, the 16th, we enacted an emergency legislative package, 2 budget bills, one of which provided $500 million and the opportunity for the governor to increase that allocation up to $1 billion. And these budget items focus primarily on kind of health and human services. We allocated monies for the county, the city, to provide emergency shelter for our homeless. So that was about $100 million. $41 million of that will come to the city and county of Los Angeles. We allocated about just under $50 million for additional medical capacity. One of the real concerns here in California is that the virus will spread so quickly if we can't get in front of it and flatten its exposure, that we won't have literally, Dominique, enough hospital beds to provide care to the people who need it. And so we literally brought back online 2 hospitals that had closed. There is a naval ship literally as we speak, sailing our way from San Diego that will dock in the port of Los Angeles that will have 1,000 hospital beds. So our real fundamental fear is that we won't have enough hospital beds literally to provide care. The bill also provided for resources for education. Senate Bill 117, with the schools closing, schools earn their money based on something called ADA, average daily attendance. And so if schools are closed, schools aren't earning money. And so we allocated resources to allow schools to continue to earn their ADA, even though they're closed, which allows them to pay their teachers, who we need to, basically continue to work to provide kids online learning experiences. And we provided resources for child care. That's where I came from before I ran for office, Dominique.
Yes, indeed.
Provide resources for child care programs to have extra resources for cleaning to make sure that they are providing deep cleaning services. We have what we call, the essential workforce, people who have to go to work every day still. And we're trying our best to make sure that those people have safe places to leave their children. So the doctors, the nurses, our bus drivers, people who work for the post office, those who provide essential services that basically keep society going, have a place to leave their children that's safe and healthy and clean.
Of course, you would think of that as, the former executive director of Crystal Stairs organization. It is a weird time, too, because usually, with these kind of flu or any kind of epidemic, it's elders and children that are most vulnerable. In this case, we've seen that with elders, but not so much children. Children are not dying from this. For the most part, children are not getting sick, but they can carry it, right? And so that's one of the reasons why. Is that one of the reasons why we had to shut down the schools?
Absolutely. They can be carriers, and sometimes, present asymptomatic. The child may have it and not even present any flu-like symptoms, but they are a carrier and can spread it to the other people in their household. That's why this was such a difficult thing to try to manage, particularly for working Californians. I knew when my son was sick, when he was school age, and if I had to go to work, it would be my mother who would say, I'll take care of the baby, just leave him with me. That's kind of our cultural norm, quite frankly, particularly as working class people. And that's the exact thing we're asking people not to do. We've got to protect our most vulnerable, those who are 65 and older, those who have compromised immune systems, the asthmatics in our life, those who have compromised lung capacity. And so that's why it's really kind of counterintuitive in terms of how we're trying to manage, which is why we're asking people to shelter in place, to make sure that you stay safe. You're practicing social distancing, which is also, I think, counterintuitive to us, to make sure that we don't spread this disease more so than it already is.
Talk to me about social distancing, Senator Holly Mitchell. The governor was kind of yelling at us and saying, you guys need to grow up and be responsible. And we're looking at the closing now of the beach parking lots and the state parks. What is it that we're not getting? What is it that we need to get and do better in the social distancing piece? Like I said, I think just innately it's counterintuitive. I too am surprised when I see, on TV, the fact that so many kids still turned up to Florida for spring break. The fact that people got the message that, I could be outside, but then they weren't keeping their distance from others. So we had literally, human traffic jams at, in hiking places, at the beaches. And so, I'm not sure what it is. People need to understand that this virus doesn't discriminate. And all of us, in order to try to get back to business as normal in our communities, in our businesses, in our state, we have to do all that we can to arrest the spread of this virus. And that means keeping people 6 feet away, washing your hands. We've got to, step up our basic kind of actions that we were really taught in kindergarten in terms of how to wash your hands and how long to wash your hands and the frequency with which we have to wash our hands.
I went to the market the other day, and literally they had orange tape. They lined us up before we could get in. They were letting a limited number of people in at a time and put orange tape on the sidewalk. So even as we queued up to get in the market, we were 6 feet apart. And the conversation in the line about that was amazing. Everything from I don't believe it makes a difference to people who are wearing double and triple masks.
Right.
Which made me think, 2 of those masks could probably be used by a healthcare provider right now.
Yeah.
So our extremes seem to be on other end. Now, people are in the parks and in public places not practicing social distancing, and yet there's a run on the market, in the market, literally, for toilet paper and water. So it's fascinating to me that people seem to have a fear about one thing, but aren't practicing what our public health officials are telling us will actually help us with the social distancing.
I also see people walking around with a mask on, and they keep touching their mask and touching their face. And as Dr. Noel Reed pointed out, you're bringing the germs and putting them on the mask. Now the mask is over your nose and mouth, so you're sort of like making yourself breathe whatever germs, coronavirus, whatever you picked up. So yeah, there's a lot of, go ahead.
There's
yes.
a lot of learning and a lot of old bad habits we have to break. I talk to people all the time that say, I just can't stop touching my face. Well, we're better.
Yeah, and definitely, don't touch your mask if you're, or, I'm wearing gloves, but I'm touching this nasty railing, and then I'm going to put this hand in my mouth. Senator Holly Mitchell, from your background, before being a lawmaker and also as being a mom, the challenges that we face. A lot of us who are moms that are also working and now have our kids in the house, and we're trying to get our work done and still be the janitor and the cafeteria lady and the teacher and the principal. You talked about some childcare for certain workers. What resources are available for parents who are just, the struggle is real right now, let me tell you.
I am so clear the struggle is real. And, frankly, this is given, social media. There's more creative people out there in the world than I thought in terms of videos and comments of now having to be, homeschooling, unplanned homeschooling.
Right.
I know the struggle is real. And, quite frankly, I have to always advocate for my youngest constituents. If the parents think the struggle is real, imagine what your young person is experiencing too. We have taken them out of their routine. They are no longer in their normal learning environment where they have a teacher who I hope they respect and who adores them, who has their pattern. They're removed from their environment with their friends. And, the social experience in school is really critically important to do for child development. So I would just ask parents just to pause for a minute and realize what your young person is going through. It's a really different kind of scenario. We are working, trust me, the superintendent of LAUSD and all school systems across the state didn't close out of convenience. It was out of necessity. And I don't believe that there's a school district in this state that will delay opening a day beyond what they think is best for our children. I know that there are districts that have online learning. LAUSD is partnered with San Diego Unified and has this amazing partnership with PBS for those who may not have computers at home or access to the internet. People are, really working overtime to figure out what we do to continue to support your children. I'm concerned about children with special needs and making sure they get the extra support that they need as well. And so government, this is why we need government. It's times like these when we need government to step up, direct resources, develop policy to support us in our greatest moment of vulnerability. And we at the state level are appropriating resources to make sure that we can support them in their needs. As budget chair, I have to say that the state is probably more prepared today than we have been certainly in recent decades because for the past 10 years we've been spending responsibly, built the largest safety net, reserve account, the rainy day account you've heard me talk about in past years. So we're prepared to make these investments in California to really help bridge us all during this difficult time. There will be loan programs and grant programs for small businesses that the federal government has already made available. You go to my state website, we have a whole page devoted to COVID-19 resources. You know, the city and the state has stepped in and said to landlords, you know, you can't evict people, either commercial property or private property, if they can't make their rent because their employment was interrupted by this virus. And so there are actions the government is taking to support our citizenry at this critical time.
And yeah, and I keep saying that, and I really do believe this. We're so blessed in California, at least in Southern California, to have lawmakers like yourself who are actually, you know, representing our interests and get it, because those are the people that are making these critical decisions. So I just think, you know, I thank you for all that you're doing, and I just think that this is a reminder to us in crisis why it's important to vote, because when the stuff hits the fan, you want to know someone's up there or over there that actually gets it.
Absolutely. And that we're, you know, we're available and in communication with the people we represent. And so while the Capitol is closed, we've closed our district office, my staff are working. We are really practicing telecommuting. We are available. You know, phones are being answered when you call either one of my offices. Emails are being responded to. You know, I'm having Zoom meetings and teleconferences all day, every day. So we are available to answer questions, and we're ready.
Senator Mitchell, we're almost out of time. Do you mind if I squeeze in a call from one of our listeners real quick before you go?
Of course. I love that.
Okay, let's go to Gina from LA. Gina, you're on with Senator Mitchell. I need the short version.
Sure. I'll be quick. I had a lot to say, but I'll be quick. Good morning, Senator. Good morning from Paige, and good morning, Dominique, and thank you so much to Stevie Wonder. Oh, my God. I just love you guys over there. Okay, quickly. I just wanted to find out, okay, with this virus, they knew, I was told back in December what I heard on TV. So if they knew by then and it's affecting people and it's killing people, shouldn't somebody go to jail for killing these people? And then if we are in gentrification, should we also we should make sure that we pay our bill, but then I don't want to wake up and see that everybody lost their place because they couldn't pay. And
Got
then
it.
another
Okay.
thing.
You don't have time for all that. I'm sorry, Gina. Call me back. We have open phones every Tuesday, Friday. You can make all of your points, and I'd love to hear from you. Senator Mitchell, anything you can say about by somebody, I think she means Donald Trump, should go to jail, but I'm not sure. Can someone be held criminally accountable? And, you know, what do we do about gentrification in this scenario?
And so I appreciate the call. As you said a moment ago, Dominique, elections matter. And people, I hope, will remember that when they show up to the polls this coming November. Elections matter. This is a public health crisis. And should he have activated the federal resources, should he have acknowledged that this was indeed a public health crisis sooner, as opposed to continuing to call it the China virus? Absolutely, he should have. But at this point, I don't think it benefits any of us to spend time thinking about shoulda, woulda, coulda, as my mother would say. We're trying to go forward based on what we know today, which, in fact, Dominic, changes every day. What we know today, what we need to do to protect Californians. We're trying to get testing kits available. We're trying to make sure that our health professionals have the gloves, masks, and gowns they need. I'm working very hard to make sure that there are hospital beds available for every California resident who will need it.
Senator Holly Mitchell, thank you so much. I appreciate you. Just give us your website one more time, if you would.
It's I never know it, Dominique. If they Google me at Holly J. Mitchell, they'll find the state website. I'd love to give you my email address if people have email questions.
Absolutely.
And
that's great.
It's senator.mitchell@senator.ca.gov. senator.mitchell@senator.ca.gov.
That's excellent. I appreciate that. And we will have your website up on our website.
Thank you.
KJLHradio.com. Thank you so much for checking in with us.
I appreciate you. Thanks to all your listeners. Have a great day.